Hello, everybody. I'm Cindy Braden with EnsoData, and I want to thank you for joining us for Careers in Sleep. What's your pathway? Before we dive in and I introduce our wonderful panel for this evening, a couple of housekeeping things. We do have many people signed up and registered, so you've probably noticed all of your lines are muted, but we want this to be highly interactive. So if you look at the GoToWebinar control panel, you'll see an area for questions. Feel free to type things in as we go along. If they're not answered in the presentation, we will try to get to them at the end. Very important housekeeping, and I'll put a note in the chat as well for everybody. For everybody who wants to see STE credit, there is a survey that will launch at the end of the webinar. So when you're done with the webinar and all relaxed and go to close your laptop, give it a second because the survey will automatically pop up. You have to fill out that survey for us to know that you participated and for us to get you your credit for the webinar. After we get the surveys in, it should take us less than a week, so give us a week, but you'll receive an email that has your certificate with it. Every now and again, those will hit a spam box. I'm sorry, my cat is will hit a spam box, so keep your eyes peeled for it. If you don't see it, just send us an email and we'll dig it out for you. All right, so learning objectives for tonight. Understanding the new and different careers and paths, identifying programs that can be implemented in your sleep center, differentiating yourself and identifying your passion, and balancing current responsibilities and career growth. With that, I'm going to hand it over to Andrea Ramberg to begin the presentation.
Hi, thank you everyone for joining us. I am with Dr. Michael McLeland. He has his PhD in RPSGT. He is the technical director for the Sleep Center at St. Louis's Children's Hospital. He is a director and treasurer on the Board of Registered Polysomnographic Technologists, the BRPT, chairs the Finance Committee and the Pediatric Exam Committee for the BRPT, the past president of the Missouri Sleep Society. Michael has been involved in sleep medicine for more than 20 years. Michael has played an active role in sleep medicine education at both the state and local level and is seen as an expert in pediatric sleep. Sarah Brenica has her bachelor's and an RPSGT and is the manager for sleep services and durable medical equipment at Northwestern Medicine. She volunteers for the American Association of Sleep Technologists, Editorial Committee, and Education Advisory Committee. She is currently working towards her master's in business administration. Sarah has worked in the sleep field for nearly 13 years and has been integral in the expansion of the DME to other Northwestern locations. She employs multiple sleep educators and sleep navigators at various locations and is a passionate expert in the field of sleep medicine. So thank you both for being here tonight. All right. So let's get started. So just for the listeners to get an idea, I really wanted to make this more of a dialogue. You know, I think this past year we haven't been able to go to any sleep conferences. And one of the main things that I loved was the conversations that happened with my peers, you know, learning about how they, you know, navigated their programs and just different, you know, lab operations. So I really wanted this to be kind of more of a Q&A and just a conversation. So you're going to see very basic slides within it and hopefully, you know, get more out of the dialogue between everybody. So let's dive in. Let's cover the current roles. So Michael, how did you get into the sleep industry and how long have you worked in the industry?
So I've been in sleep medicine for over 20 years now. Like majority of the people, I've kind of fell into sleep medicine by accident. I was kind of in between jobs of being a paramedic and an ultrasound technologist, and the university was looking for a sleep technologist or a sleep trainee at that time. And of course, at that time, it was on-the-job training, so I was like, oh, I could watch somebody sleep. It can't be that hard. And I just fell in love with it, and here I am today.
Yeah. And I know, Sarah, you kind of fell into it the same way. Myself, you know, I fell into it by kind of like accident. So tell us about how you started in the industry.
Yeah, so my story is very similar to both of yours. And my sister-in-law was in sleep. And I have a family friend that actually introduced me to sleep as well. She was managing the sleep lab here, and actually now she reports to me, so it's kind of interesting, but I love her. She's been a great mentor. So she said, Sarah, you know, I think you would really like this. Why don't you come in and shadow for the night? And I thought, wow, that would be a great opportunity. Seems like something I would love. I love people. I love working with people. And I actually came from banking. So I was working full time at a bank when I decided to make the transition into sleep medicine.
Yeah, and ironically enough, Sarah was the one that got me into sleep, and I was in banking as well. I don't know, that must be in the water around here, but and I still remember the first night that I went there, and she called REM kissing fishes, the eyes, because of how they meet, and I will never forget that. It's just I fell in love the very first night that I, got to, shadow, and I think that's a lot of individuals in this field, that just kind of fall into it. So Sarah, what is your favorite part of your job?
Honestly, today I would say it's really managing people and leading my team into, we're all very passionate individuals with sleep medicine. So my job is, it's different every single day. And I really, I value my team, and I just love, making changes. Change is very, I'm very open to change. And obviously this field is ever changing, and it really, I love it.
Yeah. And Michael, I think you kind of reiterate a little bit of change. I mean, you've made a lot of changes, it seems like, and done a lot in your career. So what is your favorite part of the job?
When I first started out in sleep, it was really knowing that I could see results right away. Being a paramedic, you drop them off at the hospital. You never know what happened to your with your patients. So that's really what got me hooked. But sleep is always ever changing. There's new stuff always being found, and especially in pediatrics, there's still a lot of things that we don't know. So that's kind of my interest, is just looking at what we can find that's new and what we can do better.
Yeah, and I hear, asking about what is your favorite part about the job. I hear a lot of the reason why underneath it, your passion for patients and all of that. So what would you say, Michael, is your reason why behind why you do what you do?
It is about patient care, especially kids. I'm really passionate about making sure that our kids are being treated and diagnosed properly, and then even afterwards, making sure that like CPAP and so on and so forth is being done and they're able to tolerate it. But yeah, it's just really, there's so much going on in sleep right now that that's really what drives me to keep doing what I'm doing.
Yeah, and Sarah, I heard you talk about leading people. I love that, because I think it's not only what we do for the patients, but I think it's also the people that we meet in the sleep field, I think are just so cool, So why do you do your job?
Really, it's the clinical outcomes too that we have with the patients, and my team, we're seeing patients in the sleep lab, and then we're able on the DME side to follow through with the patient care. I noticed, a lot of sleep labs, even some in Northwestern medicine, as we're transitioning to them utilizing our DME as the first choice. There's a big barrier between the sleep lab and then the patient getting set up on their DME equipment. And my team, we're able to identify that and really follow those patients and making sure that they're being taken care of from the beginning of the sleep study all the way through to their DME setup. That brings me so much joy.
Yeah, and and what I hear from it is there's a lot of skills that are involved in that, like as we go into the field, I think there's a lot of skills that, we need to learn in order to be successful in this field. So what skills would you think that someone should have if they're going into the field, or even maybe improve on if they've been in the field for a little bit? Sarah?
I would say, really, having that drive and that empathy is a really big skill set, I would say, for this role. Having that education piece, being open to the change, being open to learning new things, really being on the forefront of finding out why, why are things being done this way? Ask those questions when you're seeing the patient. Ask, if you work with somebody, ask them, really being able to be open to asking questions.
Yeah, and Michael, as a leader, I'm sure, and it sounds like you juggle a lot. I would imagine time management would probably be a skill, that you value. Anything else that you would suggest?
Yeah, I totally agree with Sarah. Communication is key, but also problem solving, not only just during the shift, but even afterwards. And even with COVID going on, trying to problem solve better ways to take care of our patients when we can't get them into the lab versus outside the lab, so on and so forth.
Yeah, and Michael, what advice would you have to someone new? We had participants that are less than 2 years on this webinar. What advice, to someone new would you give?
One is to ask questions. Just keep asking questions. And what really helped me was to have a mentor. Find somebody that you can ask those questions to, and then that will kind of push you. Is really my biggest two things.
Yeah, that's great. And I love I 1000% believe in a mentor to help guide and teach. I had some great mentors, and Sarah, they were the same mentors that Sarah had. But Deb Borgeson and Laura Lindley, I mean, they were the ones that invested us they would sit with us in the morning after we would do our studies and review the studies and teach us like, well, we're seeing these brain waves. What does that mean? Or what is happening with the patient? And it really helped us develop that critical thinking skill set, that you need as you advance in this field. Sarah, any leader or mentor that you would like to bring up? I know I kind of brought up a couple that have helped us, but how did they help you in your growth?
Yes, Laura Lindley and Deb Borgeson definitely were great mentors for me. And I also would really recommend joining the AAST. I found a lot of mentors through the AAST and vendors. For DME, it's been important for me to create those relationships with ResMed and Respironics. I have great mentors through those two vendors. And like I said, join the AAST. There's so much education out there for techs. And also, ask questions, find out, do you have any other sleep labs that maybe are in your organization? There's some great leaders out there that way. Yeah.
That's great. So, I think it's very easy for us to talk about mentors, but how would you recommend making connections with other sleep professionals, just other peers in your field, Sarah?
Conferences, and I know that's hard right now with COVID, but there's still, like I said, AAST is still offering some great webinars. And if you hear some good information on those, grab that name. Really listen and pay attention and grab that name and reach out, email them. I don't know about, you guys, but I feel like when I've reached out to other colleagues, they are so excited. We're all so passionate about sleep medicine that they're excited that you reached out to them, and they're, I have some there, can you talk tomorrow? And I'm like, oh, that's great,
Yeah, that's great.
I think that helps.
And Michael, I know you've talked about reaching out to other labs, how do you recommend making those connections to your sleep techs?
I mean, I know I will usually just kind of cold call other sleep labs to ask them. It's really not being afraid of just kind of reaching out and asking people. Another recommendation would be to join your state sleep society, because I think that's really a good resource too, because everybody's kind of there trying to learn and trying to get, what they need to do. But a lot of times you'll find a lot of good resources there, and a lot of them at the state level will want to be your mentor. So.
That's great. And I think you bring up another good point, Michael, with the state, because every state has different insurance, right? Like, and what they're going to pay for and everything. So I think joining your state society could really help you learn kind of the ins and outs of what your state is accepting in the areas and the payers and all that complexities that come with it. So again, joining the state society, best way to find a mentor. Sarah, any other ways that you can think? I mean, I think there's mentors in sleep, but I think there's also mentors that could be found, outside of sleep as well.
Yes, so our organization has a lot of educational platforms that we go on to, and then we're able to, any learnings that you can do with your organization, you find people and connect with people that way too. But like to Michael's point, you know, really cold calling, being brave, you know, there's really there's a lot of that great things that can come out of being brave and taking the risk, and be open to, you know, getting a no. Maybe that wasn't the right person for you, but you'll find that right person that will be there for you to help you and
Yeah,
guide you.
that's great. So, you know, when you talk about guiding techs and you talk about being, you know, because I see both of you two as mentors as well. You know, you both helped me in my career and everything. But as a manager, what qualities are you looking for in an employee, would you say?
Me?
Yeah, go ahead, Karen.
So I really, really admire employees that have that vulnerable component with them, that have, you know, empathy is really one of my strong points. So I feel like when I have, you know, an employee that comes in and wants to talk to me, you know, and even though like I have a relationship with my staff that I want them to bring ideas to me. So, you know, they feel very comfortable coming to me, and it might not be that we utilize that idea, but I want that sort of openness, that communication with them, that, you know, they feel comfortable with me.
That's great. Michael, what qualities do you feel you look for in your employees?
Yeah, I really look for somebody with motivation. I feel like if they have that motivation to want to learn, that they'll really be good at what they're going to do, because they want to do as good as possible. And like Sarah, I'm very connected with my staff, so I kind of push them every year during their evals. You know, they always have to have a goal that they want to reach during that year, and they have to complete it. And I always do like a 6-month check-in with them to see how things are going, and then really if there's anything that I can do to make sure that they can achieve their goal. And their goals doesn't have to be anything in sleep. It doesn't even have to be anything to do with the hospital. It could be personal goals. I have some employees that will, or some staff members that are going to school for the first time. So, and I don't mind reading a paper and giving them feedback. And but it's really motivation. If they have that drive, I'm really excited to have them.
Yeah, that's great. And I think both of you two can speak for the fact of furthering your education and, you know, taking that chance and taking that leap of faith to kind of go forward and to challenge yourself. So speaking of which, what has been more valuable in your career? Would you say education, experience, you know, learning new things seems to be a cornerstone, Michael, of how you got to where you're at today? Why is education and learning so important?
So yeah, I really value my education because I'm really interested in research. I'm always asking why myself. So that's what really drove me to get my PhD. But my experience, I think, is just as equal to my education, because even if it's bad experience, it's something that I've learned along the way. So I really equal both of them, I would say.
Yeah, that's great. And Sarah, I know that you're currently in school. I don't know how you balance it all. But you know, you often say so much of what you're learning in school really transmits into what you're doing in your day-to-day life. Can you speak more to that?
Yeah, so yes, going back to school right now, and I wouldn't change anything about it, because really, you know, working the night shift is when I finished my bachelor's degree in business administration, and I majored in HR. And then I just, you know, I decided to go back last year for my master's, and really everything that I'm learning is aligning perfectly with my career path right now. So I wouldn't change anything, like same as Michael. Experience and education really got me to where I am today.
That's great. And you know, what is the best job decision you ever made, Sarah? I know, you know, you mentioned coming from finance and all that. What decision would you say kind of was pivotal for you?
It was actually, I was a night tech, and I wanted to finish my bachelor's degree, and really there was an opening for a part-time day position, which as a sleep tech, you know that there's really not a lot of openings on the day shift. So I grabbed it. I said, you know, I was scared to death, because I've always worked full-time since I was 15, but really transitioning to that, finishing my bachelor's, And then what I did was the lead day tech left, the full-time day tech left, and I applied for his position, and I got it. And then the manager of sleep left, and I went to my director and I said, look, I said, I think that we should have a sleep supervisor. And she's like, okay, so what do you think? And I actually did a proposal. I didn't go to her just like that. I called a meeting, I drafted a proposal, and she agreed. There's never been a supervisor here in the sleep department that wasn't a respiratory therapist. Usually they were respiratory therapists. And I said, I think this, I'm here during the day. I think I should have this role, and this is why. And so I got the role, and then the DME director left, and I said, you know what, I think I can do both. And so I proposed to manage both sleep and DME. So that was really my pivotal story.
That's awesome. And I think, Sarah, I love that, because I think so many of us are kind of afraid, to kind of put ourselves out there, and what if I get a no? But to your point, so what? You get a no, you go on to the next thing. And Michael, it sounds like you kind of had the same experience. I mean, I think you don't take no for an answer either.
Right.
What is your greatest career strength, would you say, Michael?
I'm not really sure. I hate talking about myself, but I think the drive that I have, and making sure something is successful that I'm going to do. Getting into education really helped. Like creating programs really helped me in that role, because I was able to teach a lot of the students that were in my programs are now in these different sleep labs, and it's great to be able to have them as a kind of a networking tool as well.
Yeah, that's great. And Sarah, what would you credit to? What are your strengths for how you got to where you're at?
Not giving up, believing in what we do, believing in myself, really, too. I had to have that component, which I'm the same as Michael. I don't really like to talk about myself very much, but I did. I believe in what I do, and I believe in what I did, and I love patient care. And I would say that, that is one thing that I miss. I really do miss patient care and that interaction with them.
Yeah. So, Michael, how has the industry changed since you started? You said you've been in sleep for 20 years. I would imagine you've seen the most change out of, this group. So how has it changed in your opinion?
Quite a bit. So I think computers have taken over a lot. I started out using the GRASS machines when we were doing research at the university. So computers, and then AutoPAP came about, and then home sleep testing are the three main things that I can really think of that really changed the industry.
Yeah, and Sarah, it sounds like you've seen quite a bit of change, and just from being a night tech to managing, and then DME. And so what would be the biggest change since you've been in sleep?
I would say the home sleep testing, and then the insurance component. Having that has been really, really transitioned our sleep lab a little bit.
I'm pretty sure if we could see everyone's faces, they'd be nodding as well. I think in general, everybody can give a yeah for that. So you both have seen the sleep profession evolve over the years. So what I'd like to do is to dive into some of the programs and roles that you've seen over your time with it. I think both of you have really done some really cool things in that space. So Sarah, what are the different career paths that you have experienced or seen in the sleep field? We've seen multiple different concepts of it, but what have you seen just in your time in the sleep field of, different things that we can do in the sleep world?
Well, DME being one, I've actually been able to hire some of my night sleep staff over to DME as clinical sleep educators and setting up the patients. So that's been great for the RPSGT techs and RTs, respiratory therapists. We do have that credential and component with the setups as well. And the navigator, that the inpatient sleep navigator program that you developed, that we developed together. What else? I would say that clinical sleep educator role is very important, and the navigator as well.
You have some really interesting, roles as well under you. Can you kind of expand on that for me?
Yeah, so one that I'm really excited that the BRPT just released at the beginning of the year is the pediatric exam. So I'm really excited about that. It's really why one of the reasons why I joined the BRPT, because I was really passionate about having some type of accreditation or a certificate for pediatric sleep medicine, because as everybody knows, it's not the same as adult sleep. And then also kind of to Sarah's point is the sleep, we have a sleep navigator program and we have a sleep educator program. And I know they're kind of in the industry right now, they're kind of one of the same kind of terms that kind of, but here in our organization, it's kind of, I kind of separated the navigator and the educator, as the navigator is really actually navigating the patients into the sleep lab, where the sleep educator is now doing really just the education and working with the physicians and in the clinics and doing CPAP setups and so on.
Okay, yeah, that's great. Can you go into a little bit more detail with what the navigator's average day would be?
So she's dealing with the referring physicians here at St. Louis Children's Hospital. Most of our patients are coming as direct referrals. In pediatric sleep, most pediatric sleep labs are booked out months and months in advance, usually almost some of them up to a year in advance. So I kind of took it a different way. We're streamlining the process so we can get patients in sooner. And instead of delaying them to go see a sleep physician, the primary providers now can refer right into the sleep lab, and they can get the sleep study without the sleep referral or without seeing the sleep clinic physician. So she kind of helps the referring physicians kind of navigate what's the best way to get the sleep patient into sleep. And then also she's helping them with the clinic side. If they really deem that a clinic visit is necessary, she's helping set that up. Because here at our university, we have neurology and pulmonary that are our two main sleep providers and two different departments. So she's kind of helped navigating the patients depending on if they really need to see a sleep neurologist versus a sleep pulmonologist. And then while she's doing that, she's helping making sure that we're getting the referrals or the authorizations for insurance, and then really having contact with that patient. So when there is a clinic visit scheduled, she will then schedule the sleep study so the patient knows now what is scheduled and when, and kind of streamlines everything coming into our sleep lab.
Yeah, I love that. I see it as such an efficient process. You know, I think so many labs struggle with, okay, getting the next referral, and especially in this last year, trying to get referrals in and new business and all that. And I see that role as being so pivotal for it. You know, so many patients get dropped off or lost in the process. And I think a navigator is a perfect definition for, you know, helping that patient navigate every system with it, because we know what's going on. They don't. You know, they don't understand the next step. So I think that's great.
Yeah, and there's so many different ways to get into the sleep. I mean, there's literally 10, we counted 10 different ways to get into the sleep lab. And if we can't even figure it out, our patients and our referring physicians can't figure it out. So it's really nice now for the referring physician just be able to send us a referral, and we help them decide instead of them trying to figure out what they have to do.
Yeah, I love that. And Sarah, with your sleep educators, can you go in a little bit more detail what one of your sleep educators' day would look like?
Yeah, so our sleep educators, well, we have Denise, which is in the inpatient on the hospital side, and she's referred by a stop bank questionnaire when the patient's admitted into the hospital, but she also has great physician relationships in the hospital, so they're sending direct referrals into our Epic EMR, and then she's scheduling them right with our sleep scheduler that we have on site here in our sleep lab. So there's a great way that we're utilizing that sleep educator role. And they also, there's quite a few of them that do hold the CCSH credential as well, which is important. But another sleep educator in my office is on the DME side. So she's really capturing patients in between a home sleep study and then the automatic auto PAP. we find a lot of value in having that education being done in between those two, because those patients are not getting much education. We know as sleep techs that at night we're sitting with the patients for hours, and we're talking to them and diving into the why. Why are they here? What could happen if they qualify, or if they have OSA? What happens from there? So that role, she goes over the sleep study with the patient and really transitions them pretty well, so that we have really good outcomes on the DME side.
Yeah, that's great. And I see, in order to oversee those programs, in order to have that critical thinking skill set, I think that professional development is really important. I know you guys speak to education and all that, but what other professional development are you doing in your current day-to-day life, Sarah?
Well, besides going to school, I am in a leadership training course right now. I'm always looking for better ways to better my education and my skill sets. And I'm meeting a ton of people in our organization. Northwestern Medicine is really big. I'm also, working with a lot of the vendors to see what kind of better outcomes we can have in our DME and in our sleep lab. I think that's
Yeah. And I think, Michael, anything else to add? It sounds like it probably encompasses kind of what, but any other professional development that you do?
Not really. I think I do a lot of volunteering for different organizations that so like I chair our best practices committee, which is basically all the the committee consists of all the managers of the sleep labs within BJC. So that we kind of learn from each other, from the different sleep labs within our system. But other than that, I'm kind of like Sarah. I just really meet with the vendors, and then BJC is really big on education, so they always have classes going on that you can take to enhance skills.
Yeah, that's great. Dr. Morgenthaler gave a great presentation on Monday for the AST webinar series. And in it, he discussed seeing sleep technologists fill various new roles, such as digital data experts, defenders of clinical data, becoming payer savvy, to your point, Sarah, and integrating team-based care models, such as like a health coaching, which it kind of, highlights with the, sleep health educator and navigator. Are there any other emerging roles that you think will be critical to the future of sleep, Sarah?
Sleep psychologists. We see a big need with Northwestern Medicine with the CBD kind of cognitive behavioral disorders. And it's funny because I actually had a sleep psychologist reach out to me and ask if she could, she's part of Northwestern, so see if she could actually come in and see a sleep study and then stay for the MSLT the next day. But yeah, so we're we're developing now a way that we can all collaborate within the sleep, with all the sleep labs, and really utilize that clinical or that sleep psychologist role. I can see a need for that.
Yeah, that's great. Michael, how about you? What any roles would you think are critical for the future?
Knowing insurance, the ins and outs of the insurance industry would be key. Anything from like HR, the different modalities and PAP, really being experts in those type of areas is really key, I think, or will be key in sleep.
Yeah, and I think we're seeing different roles emerge throughout sleep. I mean, if you think about it, sleep kind of encompasses so many different areas. And I think where I would like to see us go is kind of emerge ourselves into different medical disciplines and see where we can fit in and see how we can, create our own paths within it. I think it's going to be a little bit more complicated than I think what we see now, but I think it's going to be a lot well worth it, because I think, anywhere I could see where we can insert ourselves, right?
I think too, the MAs, the MAs for those sleep physicians, they don't really have a lot of knowledge in sleep. They're there for, let's say, neurology, that's their background. They don't have a lot of sleep knowledge, and I can see that, really targeting those areas, those physician offices is going to be important.
Yeah, that's great.
And I think a credential for pediatric sleep would be I think will be important as well.
Yeah, and I've heard that feedback from a lot of techs as well, Michael. I think they're really looking forward to it, and they're very excited about the certification that came out, and yeah, that's great. So, we're talking about how all of these programs are great, and you guys can attest to how great they've helped your lab and your businesses. But so many people struggle to get them started. Being in leadership role, like, what is your advice on the best way to convince leaders that these programs or roles are important? Like, Michael, what would you suggest if a tech is trying to go to their leader?
So data speaks a lot. If you can show data that what you're proposing is going to work, but sometimes not even having the data, but knowing that, like, if we knew CHOP was doing something that we weren't doing, makes it a little bit easier if you're trying to pull off a program.
Yeah, Sarah, is there any advice that you would give techs out there? It sounds like you have really had to fight for some of these programs. What would you suggest?
Yeah, continuing to fight, take the risk, but and to Michael's point, come with data, do your homework, really look into how can this value my sleep lab. Education's important, but education doesn't always speak numbers per se, but still there's a ton of value in that role, that clinical sleep educator role. So really, like I said, doing your homework and come prepared to talk to them.
Yeah, as you can attest to, you doing your homework and coming prepared has worked out really well for you. So that's great. So with the future of sleep, Sarah, what changes do you think will have an impact on the future of sleep medicine?
Like Michael said, the insurance piece, we're very fortunate here at this location to have a sleep insurance verifier. That has been a really critical role as the changes are happening with that. So we're really kind of ahead of that. And then we do have a sleep scheduler in the office too. So those two roles have been very vital with our sleep lab. I don't know, technology is obviously changing. But I think as that changes, there's other ways to utilize your team and staff. So even though, those changes are happening and we don't have control over those changes, it's going to happen. But just thinking ahead, being prepared and thinking ahead of how this can benefit you instead of, getting bogged down and disappointed. How can this benefit your team?
Yeah, I love that insights. Michael, anything that you feel like will have an impact on the future of sleep medicine?
I agree with Sarah. I think technology will definitely play a big role. Do I think sleep technologists at night will ever go away in the sleep lab? I don't think so. But I think we have to be more than just a sleep apnea lab and look at other diagnoses instead of just sleep apnea. But I think insurance will play a big role in both the DME side and the sleep lab side. And then I think they'll kind of go to that like hospital route where, depending on patient satisfaction, compliance is how contracts are going to be made, or payments, depending on how compliant patients are, is how much you're going to get paid in the future.
Yeah, I think that's a great insight. And I think that's also another career trajectory for some of these techs, is to keep track of that, is to be a sleep coach in a sense of, and helping them stay compliant. And how do we help this model of healthcare, keep them out of the hospital systems? And one of the things that I've always loved when I was a inpatient navigator is the idea that I was catching a patient before they had a heart attack, and I was catching a patient before they had that stroke. I know that's a little hard to prove, but I like to think that I prevented some things like that. And I think that model is really going to shift. How can we get it back to taking care of these patients and the preventative, instead of being so reactive? We wait till the patients are super sick and then we're seeing them. How can we be more proactive and get people to really listen to this? I think is going to be super important. As we're seeing things shift and things evolve and everything, how do you feel is the best way to keep informed on all these changes? I feel like things are coming at us left and right. Michael, what is a way that you use to stay informed with everything?
So I'm really big on research. So if you can read the research, and research will kind of predict what's going to happen in the future, is my belief. So I really rely on reading anything that comes out in sleep about, even if it's a new medication or a new probable sleep disorder or anything like that. And then even think of things better to do, like treatment wise. Like I'm really big on treating sleep apnea in pediatrics, and we're looking at high flow in pediatrics as an alternative to CPAP. But really reading the research and then volunteering for these different organizations like the AST, the BRPT, both of the organizations, you can get so much information on what the future is going to hold or where the field is going by help volunteering.
Mm-hmm.
Yeah, and I know, Sarah, you volunteer,
Yes.
What would you think with that?
I completely agree. The AAST has really been a huge benefit to, staying on the forefront. I'll actually never forget a conference that I was at when HSTs first, were talked about, and I remember being so scared. I was a sleep tech. What's this going to do for me? This is going to change the way we're, running sleep studies. And Laura Lindley, she goes, Sarah, we have to embrace this. We're capturing patients that we probably wouldn't capture unless we ran a home study on them. I said, okay, all right. But that was literally, it was a conference. It was the first time I heard about HSTs. So join the AAST. There's a ton of webinars that they offer. I do the same for VGM, for DME, and that's VGM. I've learned a lot from some of the webinars that VGM offers. Reading, educating yourself. That's how we stay on top of the changes.
Yeah, and I think, if we're giving advice to anybody attending this, what should the webinar attendees do to improve career prospects? I know we kind of covered it with, always keeping on top of everything, but is there anything else just from you being like how you balance everything in life, any other advice that you would give them, Michael?
I'm really a big believer in balance of life. I mean, make sure that you're continuing to have time to exercise, meditate, and family time. So.
Yeah, that's great. And we were talking before everybody came on about Sarah's farm that she has at her house. So Sarah, how do you find the balance? I mean, you're running everything, but how do you find the balance between working and taking care of the donkeys?
Well, got to take care of the donkeys. I really thrive on busyness. I know it sounds terrible. If I have downtime, I'm okay. What can I do next? What can I do? But really, even exercise. I love to exercise, and that gives me the time to catch up on a show that I wouldn't normally watch, or take time for myself. And I have quite a drive, so that's where I listen to music, and it's like the calm before the storms, in between. But I do thrive on busyness. So.
Yeah, and one thing, if I can draw out anything from this webinar, and what I think both of you do so well, is change management. I feel like both of you adapt to change super well. Sarah, what is your advice on how to manage change and transition to a new process?
That's been, if I had to say, a quality that I could probably improve on, but I have done a lot being a leader. I do thrive on change. I'm always looking for, how can we do this better? And I do encourage my team to bring, those things to me too. But I really have the one-on-ones with them. And we try to do huddles, as much as we can. But, really giving them that openness to come to me if they feel like, they're struggling with it, because there's a lot of change going on here. And it's great change, but like I said, I have to recognize that not everybody does change management as well as I do.
Yeah, and Michael, I think you can probably speak to that as well. Any advice or anything you would add to that?
Yeah, it's just really embracing change and not fighting it is is the advice I could give. Like Sarah, I kind of work with my staff. We're going through a lot of changes. We went from 4 beds to 14 in less than a year. So there's a lot of change, and we're still changing how processes are as we're finding out things aren't working out. So my staff, I try to make sure that they give me feedback. So yeah, so embracing change and accepting feedback and not taking it personal is, I guess, be my two.
Yeah, and I think having them understand why, like if it's something that like if I have an associate that's really struggling with it, if I can show them this is why we're doing what we're doing and explain it in the way that he would understand it, there's better outcomes that way.
Yeah, and something that I often tell, it's like you just have to do it one step at a time. Like, I think the whole concept of what you're trying to accomplish with change, I think can be really hard to wrap your brain around. You're not meant to wrap your brain around it at the very first day. It's one baby step at a time, and then just give yourself grace and patience and allow yourself the freedom to ask questions and allow yourself to be kind of where you're at, but take that just baby step. That's all you need to do is keep moving forward. I mean, I think all of us could say, and it's not that we ever had anything figured out. I think it's just, we just kept moving, right? I mean, there were plenty of time that we needed advice or help, or we're like, what did we get ourselves into? But I think it's, with anything, you just take one little step at a time, and yeah, and just accept that. So that's great. That's wonderful for the feedback and everything. And I think, again, with trying to do this webinar and everything, I think having this open conversation and hearing about how other labs operate, I think really helps our field. And we don't know what we don't know, right? And I think the more that we get these word out of these programs and how we're doing, I think the future of sleep technology is going to change. There's a lot of adaptations and everything, but I feel like we are a passionate group, and I feel like we can truly adapt to that change. I really do, one step at a time. So thank you all for coming. Now is open time. Any questions or anything, we would be more than happy to open them up and get this going.
We had some fantastic questions come in. You guys did a wonderful job too. We were saying you guys should do a podcast because it's so easy to sit and listen to you all. The very first thing is actually a comment that came in, which I thought was just a fantastic comment from Alexander, who noticed that 14% of the people attending tonight have been in the field for less than 2 years, and how amazing it is to see people getting so far ahead of it, being forward thinking and attending webinars like this. So I just thought that was a fantastic comment. The next question that came in is, can I join neighboring state societies if my state doesn't currently have one?
Yeah, and I'm gonna let Michael answer that.
That's a good question. I know the Missouri Sleep Society would. I guess they should have bylaws on their websites, but I think most of the states are willing to accept almost anybody. Most of them are free to join. So yeah, I would definitely look out if your state doesn't have one. And this might be a great opportunity to create one, to be honest with you, especially the changes now. I think it's great to have the state, because again, like Andrea said, insurance is kind of determined by the state, and but yeah, definitely.
The next question is, how does the SDS credential from NBRC compare to RPSGT? And can respiratory therapists get hired with an SDS?
Yeah, and I'll let Michael, I think Michael has an answer to that on the tip of his tongue.
So I can't speak to what the SDS is, because I don't know anything about the exam. I haven't had anybody take the exam. In our organization, RPSGT is the gold standard, and that's what we would, but that's just, again, our organization. I don't know, Sarah, can you speak to the SDS?
I can't, no, I'm sorry.
I mean, I think I've had, in my experience, I've worked with some, but yeah, I can't differentiate between. I've seen a very smooth transition within it. I've worked with respiratory therapists that have that really smoothly transition into sleep. But to Michael's point, we would recommend the RPSGT because we go into a little bit more in depth. And from my experience with working with respiratory therapists in the hospital situation versus, you know, the outpatient lab, they get taught slightly different things. So I'm not saying that they can't handle it for sure, but I think that the RPSGT ensures that you have that right experience and education for that outpatient lab.
Great points. We still have a couple more questions, but I'm going to remind everybody as we wrap up, don't close your screen because the survey will pop up for the credits. The next question is about the sleep educator role. Is there a role of a sleep educator within the hospital system for inpatients that get put on CPAP or BiPAP during their stay? I've had a lot of patients that will come to the lab, and have no idea what sleep apnea is or why their doctor ordered a sleep study, but was just told that they need it because while they were hospitalized.
Sarah, I'm going to give you that one to you because you have a little bit of both where you're at.
Yes, fortunately, my clinical sleep educator that's seeing the inpatient population, because we're a hospital-based DME, she does have a lot of background with our, you know, with CPAP and BiPAP, but she is educating and talking to the patients about it. I can't speak to what other navigators, educators might do on the inpatient side. Michael, I don't know if yours has a little bit of background.
Yeah, so they do CPAP mask fittings and works with our T department on changing masks and stuff like that. I am working on a program now where they will actually, we're going to start doing rounds in the morning on patients that are in the hospital that are on non-invasive PAP. That will consist of a sleep tech, an RT, and a wound nurse, checking the mask and stuff like that, and then documenting and changing masks and coming up with a different care plan if we need to. But that's kind of what we're working on the inpatient side. I don't know if that helped your question.
Yeah, and I do have a DME liaison that's actually contracted through a company that we partner with. And, you know, she is identifying patients there too, and then, you know, helping assist with them if our DME is not able to take them. So I think there's a definite benefit there.
Next question comes with a compliment up front. Thanks for a great presentation. What kind of certifications would I need to become a sleep educator or a sleep coach?
RPSGT, RT, CCSH, either one. And you don't have to have both an RPSGT or an RT, but either one. And then you know, it's not mandatory that you have that CCSH credential, but it's definitely a great asset to the role.
Yeah, and I think, you know, the one thing that I noted with the CCSH and what it helped me in the navigator role was a critical thinking skill set. So it's not just the sleep component that you're looking at the holistic picture of that patient. So understanding, you know, every patient kind of gets information in a different way, and their why is different, and how they hear things is different. So I think the CCSH also teaches you how to integrate different educational tools. It teaches you how to pull in the holistic view of that patient and really take care of the patient and not just the sleep component, because as we know, we can put sleep with everything with that patient. So I think the CCSH really enables you to have that skill set to, you know, accurately approach that patient efficiently and get them that right care set and navigate that with them.
Yeah, and I think it's really important for doing any type of education that you know that there's different ways to educate a person and kind of be able to start reading their facial cues when they're not getting it, and you can turn around and transition to another learning style really easily. And I think that's where the CCSH kind of comes into play as well.
Yeah, definitely. The
Great.
multiple ways in which to approach a patient. I mean, with working with physicians, they come in, and I think a lot of patients just nod their head with physicians. I think it's kind of going right over, and then they're looking at me like, what did they say? Like, what does this mean? And I think it's being able to meet them, to Michael's point, reading their body behavior, their facial expressions, and understanding when they're vibing with you, and understanding when they're like, huh? Like, I don't get this. So yeah, I think the CCSH is a great credential for that.
Let me see, sorry. Hello, hold on. Gosh, that's a long one. So I'm gonna, we're running out of time. Is anyone using educator CPT codes for reimbursement? And then we'll do one more question and then we'll wrap.
Perfect. And Sarah, I think you can probably speak to this.
Yeah, and I think Michael did the same. So we did start billing for that code when we first launched the program, between having that educator educate the patient between the HST and the auto CPAP setup. We were getting reimbursed on some payers, but not all. So that was creating a little bit of work on the back end. So my leadership, I went to them, I said, here's the situation. This is why I value this role. This is what we should do. And they said, okay. So we did stop billing for it, but we still see the value, for that continuum of care between the sleep and the DME.
Yeah, and we ran into the same problem. Is it was costing us more to bill for the insurance than what we were really getting for it. So we found it easier just to kind of add it into the package as a whole.
Awesome. All right, so I saved this question for last because I'm not going to lie, I'm thrilled to see the question. Everybody gets to answer completely honestly. And Josh, if we ever get back to, or Joshua, sorry, if we ever get back to in-person meetings, I'm going to owe you a cup of coffee for this one. But the last question I'm going to ask that came in is, what role does AI play moving forward in sleep medicine?
All right, Michael, you want to take that one?
Yeah, so I'm very technical. I love computers and stuff. I'm really excited about AI, but I think it will, since there's not, I'm looking at it as an aspect that is, I can't find sleep technologists. As our lab, I have so many positions open that I can't fill. What this will do is will kind of eliminate me having to try to find people during the day as we expand to help score and stuff like that, where I can bring in AI into our lab and really focus on the education and the navigating, and then leave the scoring to the computer.
And Sarah, any insights about AI?
Yeah, same here. So I have so many different roles that an RPSGT can fill, and that not be bogged down by scoring all day long. Not to mention that going through Joint Commission accreditation and having to, be up to date on all the policies, all the changes. I can see AI moving forward, really optimizing my day staff.
That's awesome. Thanks, guys. And like I said, Joshua, I owe you a cup of coffee if we get to a meeting. So we are going to wrap. Look at us, right on time. I cannot thank you guys enough for joining us tonight, for being the presenters and guiding people through this. I have been in the sales side of medicine for so long, and I just keep getting so excited by the passion people have for delivering excellent patient care. And I think people showing up here tonight just goes even further to the commitment that people have to this. So thanks to everybody who joined us, and thanks to you guys for providing all of this great information.